and welcome to USTM Podcast. I am Mehzebin, your host today, and today we are having a very important episode where we are going to discuss about eye health. And today in this era of digital, everyone is using mobile phone for prolonged time. That effect is called as eye mobile. So basically we are going to discuss on that. Also we are going to dive into some of the important treatments available that we can use or we can go through to keep our eyes crisp and clear with vision. Joining us today is Dr. Dollytutu Gogoi, an expert in ophthalmology with years of experience in diagnosing and treating various eye conditions. Dr. Gogoi, welcome to the show.
First of all, I would like to thank you all and give my heartfelt gratitude for inviting me. Thank you.
Dr. Gogoi, let's start with what we are calling the eye mobile effect. With so many people, especially the young children, they are spending time hours and hours on mobile phone. So what are the main concern regarding this, using of mobile phone for prolonged time? So what are your say on that?
At present, actually, this topic is very, very important. At present, how much we deny the fact, actually the digital devices have become a very important part in our life. They are like invincible. Starting from the children to adults, we all are using the digital devices, be it mobile phones, be it laptops, be it desktops, be it iPads, everything we are using. So at present, the term which you have pointed out, the main term is the computer vision syndrome. What happens here actually, due to the prolonged use of the digital devices, because we are using the digital devices for a constant period of more than 8 hours, and when we use these devices, we actually don't know how much time we are using. We keep on using, and this has given rise to a very major, very common problem nowadays, and that is the computer vision syndrome, where the patient complains of dryness, irritation, watering, headache, digital eye strain. So this is a matter of concern at present. So I would like to discuss this with you.
That's really insightful. So could you just walk us through what exactly happened to our eyes when we are exposed to screen for prolonged time? Like how does it physically impact our eyes?
Actually what happens when we are using these digital devices are so made that when we keep on looking at the devices, they keep us hooked in and keep us engaged, and we keep on staring at the devices, whatever devices we are using, and what happens, that gives a result of decreased blinking of our eyes, and this blinking rate of our eyes gives rise to the dryness, and this dryness of the eyes can be from mild, moderate to severe, and when it is in a severe condition, that really impacts a lot. Number two thing is that these digital devices, the light that comes from these digital devices, there is a term called the blue light. On one hand, the blue light is actually important for us, but on the other hand, when we are much exposed to this blue light, that also harms our eyes. So the digital devices that gives that blue light, when we are constantly using for more than hours, that results in giving to eye strain, and that gives to headaches. So this all together makes it very difficult for the person to tolerate, and unknowingly, and this keeps on affecting the eyes, and we are not known to it. And lastly, all this impacts on the eye strain, and the patient has a long-term effect on his eyes, and he keeps on complaining about the irritability, headache, blurriness of vision. So that's the common problem here.
That brings us to a very important question. So apart from this prolonged exposure to the screen, what are the other medical conditions that you have come across during your practice? Would you like to share some with us?
This is indeed a very nice question you have put up. Actually, as today we are more concerned on the digital eye strain and the computer vision syndrome. So the other diseases, how it is affecting, I would just give a view. So number one is the myopia. These digital devices, at present it has recently been seen that the more prolonged use of these digital devices, even by the children, there is an epidemic in myopia. Now, what is myopia? In myopia, what happens? We cannot see the distance vision. So what happens, even in children now, the myopia cases are increasing. Now, there is an early need of glasses for the children. There is a epidemic has been arising and it has been seen. So myopia is a very common problem. Otherwise, if we see refractive error, which is the most common cause of blindness in the whole world, number one is the refractive error, where some people cannot see the distance, some cannot see the near, some has the astigmatism problems. So this is number one problem. Second problem is the cataract. We usually see that we usually know that the cataract is a disease of the old people, but it is not that. Even sometimes due to trauma, due to diabetes, due to rise of all these diseases also, the cataracts rate are increasing, and this is one of the second most common cause of blindness in our whole world and even in India. Number third cause is the glaucoma. If I say glaucoma, the glaucoma awareness among the people of everywhere in India to in Assam to, it's very less. Glaucoma is what? This also causes a diminution of vision, but this is a blinding disease where the patient becomes blind, and the most crucial thing is that even the patient will not have any symptoms till he or she is in an advanced stage of the disease. And once the eyes are gone, once the vision is lost in glaucoma, it cannot be returned. So some of the diseases that are prevalent needs a more kind of awareness among our people. Then some retinal problems, as we know that hypertension, diabetes, they are in an increasing hold in our present status. So this gives to retinopathies, which are usually people don't know or they are not aware, and then they don't go for any examinations and they come at a very late stage, and that causes a loss of vision too. So these are some of the very, very common problems prevalent among us, and we keep on seeing many patients this, and these are the major causes of blindness.
Thank you for highlighting those. Now, when it comes to these conditions, what do you think are the warning signs or the early symptoms that usually people should look for?
Okay, actually the first number one is any sort of blurring of vision or diminution of vision. If someone has that complaint, nobody should ignore that fact. Either he should go for a comprehensive eye checkup and a full eye checkup to a consultant ophthalmologist. So number one, I would say it is the diminution of vision, which can be a sudden, or it can be a progressive, or it can be a gradual onset. Okay. Then number two is any sort of redness and pain in the eye. It is seen that most of the people, what they do when they get the redness, everybody thinks it is conjunctivitis. They go to the nearby pharmacy and they take the medicines, they take the self medicines. They either prescribed by the pharmacist or anyone by there, and they start using those medications. But what happens is that sometimes due to mismedications, sometimes due to not knowing what drop is to be used, it can cause harm to the eyes too. So we should always, before taking any eye drops from the pharmacy, we should consult an eye doctor, whoever is available, a known person, and then we should use. So redness and pain in the eye should never be ignored. A simple redness can also lead to blindness. Okay. Then number three, I would go for watering of the eyes. Sometimes this is a very common problem where patient may complain of watering, mild watering, or there can be severe watering. So this is also a matter of concern, be it in young or be it in adults. In young, there are different conditions. In adults, there are different conditions. So that should also be a matter of concern. And the last but not the least, I would like to add the floaters. What is floaters actually? Sometimes some people complain that they are seeing some black spots in front of their eyes, or there can be some flashes of light coming to the eye. So this sort of complaint should also never be avoided, because there can be some retinal detachment or some other retinal issues. So this is what I would like to add at the end.
I'm sure a lot of our listeners will find this information so useful. Prevention is always so important in all health matters. So, are there any steps that people can take to prevent their eyes, especially in relation to the mobile eye effect?
Yeah, actually this is very important, because we all know that prevention is always better than cure. So how much I say that you don't use the screens too much, or I keep on saying my patients, and this is a very common problem nowadays. So how much you say, you cannot avoid your digital devices. That has become it has become a very important part in our life. So now to prevent that, what we can do? Number one thing, there is a rule called the 20-20-20 rule. What is this actually? The 20-20-20 rule, that is actually when you are using the digital devices, you should be very, because when we use that, we don't know how much time we are using it. So what happens when you should always either set an alarm in your watch or in your clock or whatever, in whatever way, after every 20 minutes, you should take a break of about 20 seconds. And in that 20 seconds, what you should do, you should look at a distance object that is about 20 feet away from you. And just for 20 seconds, you should relax. So that 20 seconds is very important, because you have to break the, because when you keep on looking at the, as I have already said, when you keep on looking at the screens, you keep on staring and you decrease your blinking. So that breaks that. And so that helps your eyes. So this is number one thing. Number two thing for prevention is that your posture, your ergonomics. If you are a office person, if you are working for long hours with your digital devices, with your desktop, then your position should be very important. Where you are and where and how you are using the digital devices. So if you are using a desktop, I would always prefer, if you are doing a computer work, you use your desktop, and that positioning should be in such a level that your desktop should be at a level where your eyes are at a lower level than your eyes. It should not be at the same level of your eyes. It should be at a lower level than your eyes, so that the upper lid, the lid of your eyes, covers at least some part of the eye, and that prevents the eyes from becoming dry. The third, this is very helpful when you are also, because now we work in air conditioned places. So air conditioner makes it worse. So this positioning, and our positioning should be in a table chair position. So we should maintain this position. We should try our best to follow this. Then number three, the glare that comes from the digital screens, because when we are using the digital screens, the font size, all those matters. So the glare, the reflected light that comes to our eyes, that also affect the eyes. So to prevent that, if you are a long time user of digital devices, then you can use some, there are some blue filter spectacles also available. So if you are a constant user, you can use them. Though research there are many things that whether they are helpful or not, it's still on the research process, but you can use that if you are a very long term user of these digital devices. So these are some of the points which you can keep in mind, and moreover, you can just do a comprehensive eye checkup, because sometimes what happens, you need some power and you are not wearing that. Some prescription glasses you need and you are not putting that, and that adds to the strain, that adds to the headache. So if you wear those prescription glasses together with that, then it might relieve you. So these are some of the points I would like to add on it.
That's a great point, Dr. Gogoi. You mentioned about regular checkups, right? So this brings me to the treatment side of thing. So what are the treatment that people can go through who are already facing these kind of issues or going through these symptoms?
Okay, the thing is that first of all, you have to be sure that you are having this. So you need to be diagnosed first before taking the treatment. So first thing is that you should have your comprehensive eye checkup. You should get your eye checkup done, because not every cause of irritation, headache, watering, and digital eye strain can be, that will give a diagnosis of computer vision syndrome. So first you should be diagnosed whether that is there. And then if you are really having those severe dry eyes, then dry eyes can be graded as mild, moderate, and severe. So according to that grading, there are some eye drops, there are some lubricating eye drops we prescribe to the patients. So then if you are diagnosed according to the severity, the treatment is different, and we go for those type of conservative treatments only first of all. Then surgery or something else according to the severity, that is always the last resort. So I would always say the first treatment is the prevention. That is, we have to, whatever I have already said in the previous question, the precautionary measures. We have to take the precautionary measures of using the 20-20-20 rule, and then how we can, we have to find measures how we can decrease the screen time. One more thing I forgot to add, that as we are using the mobile phones, even in the desktops and laptops, there is an inbuilt system of screen time. So we can make that on, and then we can see how much hours we are using it. So that also helps and adds that. So number one is the conservative treatment, and surgery is the last resort for that. So prevention we have to take. That is the most important thing I would say.
Thank you for sharing that. Now, I would like to address to our listeners directly. What message would you like to send to the society regarding eye health and importance of taking preventive measures?
I would indeed like to thank your team for giving me this opportunity, because eye care and eye health is something there's awareness which we are really lacking in. This is because that is why I would like to spread this message through you that uh, when you are having any eye problem, eyes does not mean just getting your specs. There are many other diseases. When you think of your eyes, you should be very careful because you just have your two eyes. So I would always give the message that when you go for your eye checkup, do a comprehensive eye checkup. What is comprehensive eye checkup? Comprehensive eye checkup means it is not just your power eye checkup, because whenever eye checkup comes, it is just the thinking that only you check your eye power and you get your glasses done. But that is not the end of your eye examination, because your eyes, there are many other parts of your eyes that also has to be looked in, be it your retina, be it your glaucoma eye checkup, be it your eye pressure eye checkup, be it your cataract eye checkup, that is your lens status. So as a whole, you should get your eyes checkup done with a good doctor, with a good eye consultant, so that you get to know your eyes properly. And I would always recommend that be from young to adults, be it children, you can go for a yearly or a 2-yearly checkup, and when you become an adult, you should always go for a yearly eye checkup, a comprehensive eye checkup where all your parts of your eyes been examined. So this is very important regarding that. And please don't ignore the common symptoms. Please don't take medicines from the pharmacy by yourself, because that can also lead to a lot of problems. And in this emerging world of diabetes and hypertension, there is also an effect on the eyes called diabetic retinopathy, hypertensive retinopathy, which are very common. Glaucoma is very common, cataract is very common, myopia, presbyopia, astigmatism, these are the very common conditions, and so you should not ignore these problems. So I would suggest that you should do a comprehensive eye checkup. Thank you.
To our listeners, thank you for tuning into this special episode of USTM Podcast. Remember that taking smaller steps like maintaining a balanced diet, taking regular checkups, and reducing our screen time can make a big difference. We owe it to ourselves and our family to take care of our vision for lifetime. If you found this episode helpful, be sure to share it with others so that we can together work to spread awareness about eye health. Stay tuned for our next episode, where we will soon dive into another topic of health and awareness. Till then, stay safe, stay healthy, and just remember, healthier eyes means a brighter world. Thank you.